The National Pensioners Association (NPA) has introduced a pensions medical scheme ID card to cater for the health needs of retirees. About 62,000 pensioners grouped under the SSNIT Pension Scheme would benefit from free medical services when they present their cards at selected medical facilities across the country.
Workers who retire from active service often suffer illnesses associated with old age. With the meager pensioners' benefits they receive every month, they are unable to afford cost of treatment for certain ailments. In view of this, the National Pensioners Association (NPA) in 2012 established a fund to which members are to contribute monthly dues of 4 cedis to offset some of the costs incurred during treatment. Members who are roped into the scheme will have to present their National Health Insurance Scheme card in addition to the Pensioners Medical Scheme Unique ID card at health facilities. This PMS ID card enables the bearer to access medication from pharmacies, laboratory services, eye and ear care. The Minister for Employment and Labour Relations, Mr. Haruna Idrisu, who unveiled the PMS ID card, appealed to personnel from various health facilities not to frustrate pensioners' bid to access health care.
I am advocating the establishment of a health support fund to support workers and to support retirees when you proceed on pension. This must be a partnership not led by government, but led by you workers. Within 5 years, it could accumulate 115 million Ghana cedis with just 3 cedis contribution from workers. That should be able to cater for known ailments to which the National Health Insurance Fund have not been able to cater for.
The head of Pensions and Social Protection of the Trades Union Congress, Mr. Seth Ablosu, expressed concern about the misuse of pensions fund for donations by SSNIT.
We are part owners of the scheme. We are not customers. It's like a will with beneficiaries. And along that line also, no money from SSNIT should go to any other purpose other than for pensioners. Over the last World Cup, we heard that SSNIT paid 1 million cedis to support the Black Stars. That is, regrettably, I must say, an example of profligate expenditure. SSNIT did not need to pay that money. SSNIT has no business making funeral donations.
The General Secretary of the National Pensioners Association, Mr. Edward Ameibo, spoke to GBC 24 about his expectations of the NPA initiative.
In the past, many of our members have gone to the hospital and then they've been told that it doesn't cover things like the prostrate and so on. National Health Insurance says they are covering it. But when you go to the hospitals, they don't treat you that way. So we want to assure all the hospitals that with this we have adequate funds to support it. So they should organize it.
Pending the approval by the Ministry of Health, the PMS identity card will be operational in March this year.